If you think Medicare and Medicaid are the same thing, be careful. Thousands of people confuse these programs every year, and that confusion can end up costing them money, coverage, or even access to their doctors and medications. So in this video, I'm going to explain the difference between Medicare and Medicaid in a simple and clear way. No complicated language, no confusion, and step by step. Especially for people turning 65, helping a family member, or trying to understand how health coverage works in the United States. Hi, I'm Jose, and honestly, many people never receive a clear explanation about Medicare and Medicaid. They get too much information, too many phone calls, too many commercials, and they still end up confused. So today, we're going to simplify everything, because understanding this can help you avoid expensive mistakes. First, what is Medicare? Medicare is a federal health insurance program. It is generally designed for people age 65 and older. Some people under 65 with certain disabilities or medical conditions may also qualify. Now, one of the biggest things that confuses people is that Medicare has different parts. For example, Part A usually helps with hospital coverage. Part B helps with doctor visits, labs, and preventive services. Then there's Part D, which helps with prescription drugs. And there's also Medicare Advantage, also known as Part C. And this is where many people start feeling overwhelmed because they hear Part A, Part B, Part C, Part D, Medicare Advantage, supplement plans, and suddenly everything sounds complicated. But don't worry, today we're focusing on understanding the difference between Medicare and Medicaid. Now, what is Medicaid? Medicaid is different. Medicaid is a state and federally funded program designed mainly for people with limited income or certain financial needs. Depending on the state, Medicaid may help cover hospital visits, doctor visits, medications, and long-term care. And something important to understand, Medicaid does not work exactly the same in every state. For example, Medicaid benefits in Florida may be different. Now let's talk about the biggest difference. Medicare is usually based mainly on age or disability, while Medicaid is usually based mainly on income and financial need. That means someone may qualify for Medicare simply because they turn 65, even if they have a high income. Now, yes, some people can have both Medicare and Medicaid at the same time. This is called being dual eligible. And this is extremely important. Medicaid can help cover costs that Medicare does not fully pay, like copays and deductibles. And this is extremely important. Medicaid can help cover costs that Medicare does not fully pay, like copays and deductibles. Now I want to talk about common mistakes, because this is where many people get into trouble. First mistake, thinking Medicare covers everything, and that is not always true. There can still be copays and deductibles. Second mistake, choosing the plan only because it has a low premium. A low premium does not always mean low overall costs. Third mistake, not checking whether your doctors accept the plan. People choose a plan and discover their doctor is out of network. That's why it's important to review your doctors, your medications, your hospitals, your budget, and your personal healthcare needs, not what works for someone else. And honestly, many people feel frustrated or overwhelmed with Medicare because the system can feel complicated, especially when they're receiving conflicting information from different sources. That's why education matters so much. And that's exactly why I make these videos, to help you better understand your options in a simple and clear way. Now, if this video helped you, please like, subscribe, and follow for more Medicare education. If you want the free Medicare checklist, comment Medicare list. You can also schedule a free Medicare review at medicarejose.com/calendar or call or text 863-204-5225. You can also download the checklist using the links in the description. And please share this video. Thanks for watching, and I'll see you in the next video.